Hi, everyone. Welcome to IHA's pre-conference webinar. We're going to get going in a few minutes, just letting people in, so welcome. This is Addressing Health Disparities, what health partners and adult educators can do together. We have a great team lined up to be talking to you today, so we'll get started in a minute. Okay, welcome again, everyone. In just a minute, we'll get started. This is Addressing Health Disparities, what health partners and adult educators can do together. I'm putting a few things in the chat just to let you all know. All right, I think we are about ready to get started. Welcome everyone to this IHA webinar. I'm Julie McKinney, and I am going to be moderating this amazing team for this webinar. We have a great team. And the topic is what health partners and adult educators can do together to address health disparities. Just going to go over a little bit of housekeeping, and then we will let our people get started. So sorry, hang on a second. Okay, so just please connect to audio using your computer speaker so you can hear us. You will all be muted during the presentation. If you have questions, please use the Q&A button at the bottom of your screen. It's the one on the bottom right. If you have questions for our speakers, please do use the chat. We'll be asking you to introduce yourself in the chat, and you can do comments, share resources, anything. Please use the chat. But for questions, which will come at the end for our presenters, if you use the Q&A button, that's much easier for us to manage the questions, and we will get to questions. So the presentation will be recorded, and you will be able to see the slide presentation. So that will all be on the IHA conference site, so don't worry about that. If you are requesting CE credits, there's 2 evaluations that you need to fill out, one after this session, and the other one after the entire conference is over later in the month. I'm putting that in the chat too, just so you know about that. So that's for CE credits. With that, we're going to get started. We have an amazing team today. I have known all of them for many years, actually, and you are in for a real treat. They know their topic, and they are great speakers and educators and people. So I'm going to introduce them one by one and then turn it off to them. Marcia Hohn is a consultant in literacy and health. She's from Massachusetts. Greg Smith is the executive director of the Florida Literacy Coalition in Florida. And Janet Ohene-Frempong is a health literacy consultant. She's been working with IHA for many years, as well as her own J.O. Frempong Associates consulting agency. And then last but not least, Paul Jurmo is a consultant and chair of the Open Door Collective, part of the Labor and Workforce Development Group in DC. And they'll tell you more about the Open Door Collective throughout this. But with that, I will turn it over to you all, and look very much forward to this presentation. Thank you.
Hi, everyone. I'm going to jump in and try to get this moving. We've got a relatively short time to cover a big topic. So the way we've organized this is around sort of 3 issues. First, we're going to start off with an overview of the interwoven challenges and opportunities that this webinar is responding to. Secondly, we'll talk about in more depth about why and how various stakeholders might work together to respond to these both challenges and opportunities. And at the end, we'll just talk a little bit about how you might access relevant resources and get involved in the Open Door Collective and other organizations if you're interested. As Julie said, these materials will be available to you through IHA, and she'll explain more if as necessary. So let me get started with that overview of the interwoven challenges and opportunities that we're responding to. First is I would like to give you an overview of these sort of the four main challenges and opportunities we're going to be talking about in a little more depth in a minute. But first is that there are 43 million, an estimated 43 million United States adults who lack basic skills, which we are defining as not just reading and literacy in the kind of traditional sense, but reading and writing, speaking and listening, numeracy, digital problem solving, digital literacy, as well as problem solving skills and so forth. And this is primarily in English that we're talking about. They might also lack a high school credential. That's and all of these, both the skills and the credentials, are things that all of us as adults need in this country to perform our various work, family, civic, and academic responsibilities. A second issue is that to clarify a bit more who these people are, these include both US born individuals as well as immigrants. It includes younger and older adults as well. And they come with diverse strengths, but also they can have personal and situational challenges that we'll mention later. Basic skills, or their lack thereof, can make it difficult to maintain their health and that of their families, and thus the focus of this webinar. And the fourth is really an opportunity for you as health educators, that adult basic skills programs can serve diverse educational and other needs of these learner populations. And health-related issues are, in fact, one area that health educators and adult educators can work together on. So with that, I'm turning this over to Marcia. Marcia, I don't know if you're muted.
I'm here.
Muted. Okay, there you go.
Okay, here I am. So I just wanted to share some statistics with you about how adults with lower income and basic skills are severely and disproportionately impacted by COVID-19. As you may be aware, Dr. Fauci has been all over the news about these disparities. And what I found when I looked at the statistics, now, this is partly because Black and Latinx adults are concentrated in work and living environments that have much higher COVID exposure. And so that when compared with white populations, we found that Black adults have 1.4 the rate of COVID, are hospitalized at 3.7 times, and dying at the rate of 2.8. So that just means that, you know, for every 100 white adults, 140 have COVID, 170 are have been hospitalized and dying at the rate of 2.8. Now, the rates for Latinx adults are even higher. They are infected at a rate of 1.7. Native American populations are likewise impacted. For example, in New Mexico, Native Americans are 10% of the state population, but 23% of COVID cases and 41% of deaths. Now, obviously, disabled and older adults are also disproportionately affected, but not at the rate of the Black and Latinx and Native American populations. So next slide.
Okay, thank you, Marcia. Just to elaborate a bit further, that the adults that we're talking about can be at special risk for health disparities due to a number of factors. Up until now, we've mentioned basic skills as one of the barriers that they might face and which might impact their ability to manage their health and that of their families. But employment, income, housing, transportation, healthcare access, language, as we mentioned, background knowledge related to US health issues, social inclusion or lack thereof due to racism or anti-immigrant sentiments, for example. These can all be factors that the adult learners or adults who have basic skills limitations are juggling at the same time of having basic skills limitations. And I think that you as health educators, have heard the term social determinants of health. And this is a pretty comprehensive list of some of those determinants. And I'm sure there are others as well. So just to, this is to keep this in mind as we go forward. Now, to turn to the opportunity side of this, the U.S. adult basic education system. Some of you might be very familiar with this field. Some of you this might be very new to you. But these are a mix of types of programs in the United States that provide instruction around literacy, numeracy, English for speakers of other languages, basic computer skills, high school equivalency, workforce preparation, in some cases health education, citizenship preparation, special education. There's this whole mix of programs, often not very highly coordinated or very strong in terms of their budgets, but they're out there, and these are institutions that you might work with if you haven't already. They operate in public schools and community colleges, community-based organizations, correctional facilities, labor unions, workplaces, and other kinds of institutions. They serve both older and younger adults, immigrants and US-born individuals, diverse races and ethnicities, religions and genders, and so forth. And they provide other types of support, typically for employment or family or health, legal, prisoner reentry, immigration, citizenship, and other issues that adult learners might face. And these programs bring, or can bring, and often do bring, some special strengths to this question of how to support the health of adult learners. Number one, they provide access to hard to reach populations. So if you as health educators are interested in reaching this population, adult education programs can be a vehicle for doing that. They also have expertise in teaching adults with low literacy skills, something that you perhaps are not trained in or haven't had much experience in. They provide teaching time in the sense that the adult learners come to these programs, they're sitting in class, they're engaged in the program. This is a venue and an opportunity for integrating health-related topics into the other educational activities already going on. It also provides a trusting environment. We know this is very important for adult learners to learn about health. Often these folks maybe are reluctant to reveal their limitations, or they're facing other challenges. Adult ed programs can be a very kind of a welcoming environment in which they trust the teachers, they trust the staff, and you as health educators, if you were involved, you would come, I think, with the blessing of those trusted individuals. And finally, you typically have very motivated people. They want to learn. These are volunteer programs for the most part. Nobody's forcing them to go there. It's not like K-12 where kids are mandated to go to school. These are people that come of their own volition, and they typically are highly motivated and they want to learn. And if the topics are relevant to them, they could be all ears. So now we turn to the question, the second part of this, which is how can adult basic skills programs and health partners, as we call them, work together? We've published a number of publications on this topic, one of which is illustrated there. You'll be referred to that if you want to read it in the, and then we encourage you to read that and other health-related issues, publications, sorry, that the Open Door Collective has developed. The way we're defining the stakeholders in this case is, number one is the adults with basic skills limitations that we've already talked about. Number two is health partners, who we define as individuals and organizations and agencies that support public health and/or healthcare jobs in various ways. And these could be everything from health educators to direct service providers, healthcare service providers, funders of programs, policymakers, researchers, employers who are looking for individuals interested in and prepared to work in the healthcare field. These are the kinds of partners we're talking about. A third category of stakeholders is the adult education service providers that we've just described. And the fourth category is what we're calling social justice advocates, who are various kinds of organizations and individuals who are concerned about the well-being of adult learners and their families and communities. And we think there are roles for all of these stakeholders in various kinds of partnerships. Then the question comes, okay, so how can they work together? That document that I showed you earlier identifies 9 forms of collaboration. I don't think we have time to go into all of those right now, but I will just say today we're going to touch on number 1 and number 3, health literacy education and direct healthcare services for learners. There's also healthcare job preparation and other types of collaborations. Again, due to time, we're not going to go into those, but we urge you to take a look at our document. And finally, the benefits. Why do this? What's the point? Well, number 1, learners can develop various kinds of skills and knowledge that can help them navigate various health issues in the healthcare system. In some cases, they can learn how to attain and succeed in healthcare industry jobs. The second set of benefits go to the health service providers, people like yourselves. You can get access to a population or populations that you maybe don't normally work with or don't have easy access to. Third is adult educators. We as adult educators, and that's my background, by collaborating with health partners, we improve our ability to work with adult learners and to help them deal with a relevant issue, which is health-related issues. And through these collaborations, adult educators can also just develop strong relationships with a new important set of community partners. Another set of benefits go to the healthcare industry employers who are, potentially can get access to individuals who've gone through a basic skills program. They have the math, they have the English and other kinds of skills and understanding of healthcare jobs that make them good candidates for working in healthcare. Policymakers, funders, and researchers can also, through supporting these kinds of partnerships, improve their ability to help adult basic education, ESOL students deal with health issues, and the larger community benefits from having community members who've gone through these programs and are better informed and active related to health issues. And this results in improved community health. So with that, I'm going to turn it over to the rest of our panelists, and you see their names here, and we'll start with Janet. And again, feel free, as Julie said, to post questions in the Q&A as we go through it, and we'll try to respond when you're finished. Thank you so much, everyone. Janet?
Okay, next slide. So keeping in mind everything that Marcia and Paul have just said, if you could go back one slide, I'm going to introduce a new concept about, about how health educators can collaborate with the health partners that Paul just listed, with an added focus on civic literacy as one aspect, civic literacy, that is, as one aspect of health literacy. So let me explain. Next slide. Okay, so there are many different, there are at least 17 definitions of health literacy. They're quite similar. But just for this presentation, let me just keep it really, really simple. It's essentially about your ability to figure out what's needed for you and others to stay alive and as well as possible. We can add safety into that as well. But that's what we're basically trying to do. What do you need to know to stay alive and to stay as well as possible? And not just you, but your family and other people that you care about. Next slide. So if we look at health literacy that way, let's just go back to 2005 and pick up an article that was written by the Zarkadoulis team of Pleasant and Greer, Zarkadoulis, Pleasant and Greer. That's and even though it was written in 2005, it has great application going forward and certainly today. And here's what their model suggests. This is understanding health literacy, an expanded model. Their model suggests that becoming functionally health literate, as we just described, actually requires some key abilities in 4 central domains, essentially different kinds of literacies. And they include fundamental literacy, which we've been talking about. That's ability to read, to write, decode and so forth at fundamental levels. They mentioned science literacy. They mentioned cultural literacy. Those are 2 things that we could spend some great time about. But in the limited time we have, let's just focus on civic literacy. Next slide and see what they were talking about. Here's what they said civic literacy is. They say it refers to the abilities that enable citizens to become aware of public issues and to become involved in the decision-making process. And I think I'd like to expand that to include people beyond citizens. It's really everyone, but certainly citizens, people who can vote. And they listed 3 requirements to achieve some degree of civic literacy as it relates to health. So first, an awareness that individual health decisions can impact public health. So in the context of this pandemic that is ongoing, even though it seems to be abating a bit, but it's still here, here's an example. Should I wear a face mask to protect other people or not? It's an ongoing issue, even as the vaccine has presented itself. What are we supposed to do? All right, next slide. Okay. The second thing is having some level of media literacy. And that was their suggestion as news applies to safety, health, and healthcare related issues. So for example, should I get my information about the pandemic from this source of news or from that source of news? And I suggest that where you get your information can be actually a life and death decision. Some information will be accurate, some information may be less than accurate. It depends on where you're getting your news from. Next slide. Next slide. And go back 1. And then the third thing is a basic knowledge of civic and governmental processes as they apply to health issues. Now, this is a complex issue. All right, go back a bit. Let me just talk about that for half a second. Go back 1 slide. All right, for example, what do I need in the past? We all had to, or at least many of us had to make this decision about what do I need to do to figure out how to safely vote by mail in the midst of this pandemic? Going forward, there are many other issues, and we'll talk about that right before I draw this to a close, about what kind of things do we need to be aware of in order to make sure that we're able to stay alive and stay well? Next slide. So this is a paradigm shift. This expanded way of thinking about health literacy really involves a paradigm shift that points out the fact that in order to have some personal control over your ability to stay alive and well as possible, and that includes taking into consideration the things that Paul mentioned earlier. It's not just about being able to read a pamphlet about your diabetes, for example, but it has to do with things, policies and legislation that have to do with employment, your income, basic income, housing issues, transportation issues, healthcare access issues, language issues, and all of those kinds of things. They affect our ability to maneuver our way through this life in the healthiest way possible. Next slide. So in other words, you need some basic civic literacy skills to really round out your sense of health literacy. Civic literacy includes being informed about and active in political decisions that affect your ability, all of our ability to stay alive and well. We have candidates at the local level, at this county level, at the state level, and at the federal level, not to mention all of those that get appointed. And they'll say, I'm for this way. Somebody will say, I'm for that way. And the questions we're asking is, what are you going to do to help us keep us alive? Because we've lost so many lives in this pandemic. And how will you help us to stay well? It will vary from one state to the next, but these are the kinds of things that we possibly need to think about in addition to promoting fundamental basic literacy skills. Paul?
Sorry. Thank you so much, Janet. Greg, I'm going to hand it over to you.
Okay, great. Thank you. It's my pleasure to talk with you today about a program that we've been doing here in Florida for the last 11 years. The Florida Health Literacy Initiative provides annual grants, access to curriculum, professional development, and technical assistance to our network of organizations that include adult education, literacy, English as a second language, and family literacy programs. Through this work, we've partnered with programs interested in integrating health education into their curriculum in meaningful and impactful ways. The focus is teaching basic skills, again, English language literacy, math, digital literacy skills in the context of health education. And it works well. And that's certainly been our experience, and we have some data to show it. It was referenced earlier that, and if we can move on to the next slide. That the lack of health literacy is certainly a significant issue in our country, and research shows that students that we typically serve in adult education are disproportionately affected and are much more likely to have low health literacy skill. The COVID pandemic has certainly shined a light on health inequities in our society, and we believe we have demonstrated that adult education literacy programs are in a very good position to have a real impact in this area, given the trusting relationships that they have with teachers, as was referenced earlier, and the contact hours that we have with students over time. So we teach health literacy, nutrition, about the US healthcare system, which for many of our ESL students can be quite different from how health services are delivered and paid for in their native countries. We talk about health insurance, chronic diseases, preventative health, and of course this last year, we've talked a lot about COVID-19. In general, we strive to share health information and strategies on how students can find reliable health information so they can make informed choices about their health and nutrition for themselves and their families. It's really a contextualized learning approach. And we have a number of stories of lives being saved because students acted on information that they learned through the program. We work with partners and at the local level who get these grants, and we collectively served over 21,000 students in every region of Florida. And this initiative is absolutely dependent on having strong partnerships with health providers and other state and community stakeholders, starting with our sponsoring organization, Florida Blue and the Florida Blue Foundation, which is our Blue Cross and Blue Shield insurance provider here in Florida. They've been incredibly generous, both financially and in providing other kinds of resources, always supportive, really a great partner to work with. The Florida Department of Education has also been a key partner, funding the development of our original health literacy curriculum, as well as providing additional support over the years to add to that curriculum, as well as offer professional development and training. And of course, our adult education and family literacy local program partners who receive the grants do phenomenal work developing and implementing programs in creative ways that are really geared toward the needs and interests of their students. These are typically nonprofit or library-based providers, school districts, or community colleges here in Florida offering adult education. The grants are $5,000, so not a whole lot of money, but they put the dollars to really good use and often are very good at leveraging other resources to support these projects. Next slide. So partnerships are really a cornerstone to this, and these are just some of the partners that we've engaged over the years. It's really a range of organizations. Some of them are squarely in the health space, community health clinics and hospitals, pharmacies, local health department, fitness centers, med schools and nursing schools have been really strong partners, and it's been a real win-win. Their students are able to get a practicum experience and doing presentations and health screenings and so forth, and it's been very helpful to our local programs to have that. Health insurance navigators, poison control, fire departments, really the local programs have been very creative in how they've engaged local partners, and we really think this topic lends itself to that very well. And on our website, and I'll share some links here right after I'm concluded in the chat. We have some good examples of how those partnerships have evolved and who we've partnered with. Next slide. One of the things is field trips and classroom. We really want this to be an engaging hands-on experience for students. They love to have opportunities to have people come into the class or go out and do field trips to clinics and hospitals, really becoming familiar with their local health services, health fairs, Zumba classes, going to grocery stores. And one of these photos here is a grocery store chain that's very welcoming, and as folks walk through and look at healthy options in terms of food purchases, and and this crosses over into the financial literacy space as well. Offering classes, CPR, first aid. Sometimes these classes are prerequisites for pursuing a career in health, and we do talk about that as well. And we have a publication looking at job opportunities and careers that require 2 years or less of post-secondary education. Next slide. A big part of what we do is incorporating, and this is sort of the expectation around the grant, is to have a project that the students are engaged in. So we really focus on project-based learning, and the students come up with really some interesting projects. It's really sort of a learning while doing experience, maybe doing a mock clinic or a health fair. 100-mile club is one that one of our programs has done for several years, where students have to walk 100 miles. They pledge to do that, or a walkathon. They've done rap songs, YouTube videos, cookbooks that kind of take some of their recipes from their home country and use healthy ingredients substitutions. A big variety, and again on our website we have some examples of what's been done over the years. This photo here on the top is a community garden project that is supported through our cooperative extension IFAS program. One of the local providers, actually several organizations have done this now, where they have a nutritionist come in, master gardener, helping them to do a box garden, and then they pick the vegetables and fruits and so forth and have kind of a big meal at the end. At least they did pre-COVID. They're kind of having to modify some of these projects this year, but for the most part, this is a really good way to engage students and again, learning by doing. Next slide. One of the things that sort of supports this effort is a curriculum that we've developed, and there's lots of good resources out there, but I just wanted to share this with you. It's a Staying Healthy series of books that we're pleased to say, have received several awards and are freely available. The original book, the blue book up in the corner there, which was co-authored by our own Julie McKinney, our facilitator today. And it really continues to be our most popular book. It's been downloaded over a million times, freely downloadable. It's written at a 4th to 5th grade reading level and is suitable for sort of low, intermediate literacy and ESL students. The orange book is even at a more basic level, Staying Healthy for Beginners. And while this is used by adult educators and has a teacher's manual as part of it, it's also used by a lot of community health programs outside of adult education, because the language is simple, plain language, uses lots of images, structured vocabulary, and so forth. It covers pretty basic topics around visiting a doctor, reading and understanding medicine labels, understanding a little bit about chronic diseases, nutrition. And so this, along with a few other items that we have a one on women's health and coping with stress, and some videos that go along with this, and additional lessons and activities. It sort of is the cornerstone in terms of the curriculum that our programs use, although they're not required to use it, they opt to use it. These, again, are all free to download. And a few of them, the blue and orange book, are available to purchase too, and it's $5 or $6 for those. So I encourage you to check it out if you're interested in seeing that resource on our website. The next slide.
Great.
Oh,
Yeah, Greg, about 2 minutes, please.
okay. We have a free online course as well. And this is just a self-paced course that kind of corresponds with some of the materials that we have. Next slide. I want to talk with you a little bit about some of the results too. What's the impact? Why do we do this? We've been doing this long enough that we really have some longitudinal data that really shows that there is a significant impact. We do a pre and post health literacy assessment. This is data from our last year. 77% of students showed an improvement in terms of their health literacy skills. But we also ask in a survey format, if what they've learned has helped them in their daily lives, and if so, how so. And we get good feedback in terms of people exercising more regularly, eating better, feeling more comfortable visiting a doctor, getting insurance. About 31% of the folks who were not insured going into the program did apply for insurance through a variety of different kinds of insurance, the marketplace and Medicaid and so forth. So the impact is pretty significant. We don't see any reduction in retention levels, which is really good. I mean, in fact, a lot of times programs are reporting better retention with students because they're engaging. So we just, in closing, I just want to encourage you to look at adult education, as we've been talking about throughout this session, as a great community partner. I think in terms, if you're doing, pilot projects or research and so forth, really these programs can provide sort of a unique opportunity to access language minority population, or folks who may have other risk factors that might work for what you're trying to study, and be a real win-win situation. So thank you.
Thank you, Greg. That's fantastic. Marcia?
Yes, hello, everyone. It's Marcia in Massachusetts, and I'm going to be talking now about learner access to health services, learners in the adult basic ed programs, and with a particular focus on collaborations with community health centers. Next slide. Now I'm focusing on community health centers because they have overlapping responsibility for the same populations of adult basic education programs. Now, there are about 1,250 federally qualified community health centers and 8,000 sites across the country. So they're not everywhere, but there are many other public health organizations that have rich partnership potential. And in that mix, I would put prevention centers, very much increasingly hospital community outreach, which has accelerated now with COVID, and community health workers associations. And if any of you have other ideas, please put them in the chat bar. Now, we mentioned before, COVID-19 has laid bare the layering health disparities that impact in communities with both health and basic skills challenges. And so we really need to be rethinking about new strategies. Next slide. Now, the reason I'm concentrating on community health centers, but again, let me emphasize that is not the only organization that has overlapping responsibilities or would be interested in partnerships. But with the community health centers, Both of those organizations really understand the documented connection with low literacy, limited English, and poor health. We started discovering that back in the 1990s with the research, and now it has accelerated. Now, community health centers, they are the primary preventive care for such underserved populations, but they really struggle to reach those populations. Adult-based education serves the educational needs of the same population, so partnerships seem like a logical thing to do. Next slide. Now, there are great benefits to both partners in improving the health of ABE learners. Remember, this is a population for whom both systems are responsible. First of all, you'll be reassured to know that there are robust models that exist of how partnerships work, and we'll mention some of those when we get to the resource part of the webinar. And in those partnerships, the adult basic ed programs, like Greg's really described, they provide expertise in teaching low literate learners. They have greater learning time and a trusted environment. That's really important. I've heard trusting environments for the learning to be a crucial part of people's absorbing and acting on health messaging. Now, the community health centers have what adult basic ed programs don't have, and that is medical expertise and access to services. They also provide critical prevention services, and they build knowledge about other services out in the local communities. Next slide. I think we should go back. Oh, no, sorry. Okay, take this one. Okay, so I want to share an example of an adult basic ed community health center partnership. This is in Lowell, Massachusetts, and they had a long-term trusting relationship with the local community health center. Now, it started off with very pedestrian things. The health center came in and they did flu shots and blood pressure and blood sugar screenings for the students. But then it was the health needs of the students were so great that they started instituting twice weekly visits by the community health center at the adult basic ed program. And those were supported by the Department of Education here in Massachusetts. They also developed a joint project on mental health. This was because they said so many of their students were really traumatized through a variety of life circumstances, both here in the US and abroad. And so they had already been talking about doing this joint project and had gotten funding from a local community foundation. But since they had been talking so vigorously about their joint project, when COVID hit, they just were able to hit the ground running. And they were able to get services, testing and services for their students, and it helped promote the learners identifying the community health center as their healthcare home. Next slide. So I think we want to start talking, about getting started about all of this. So let me just, say a couple of things. While potentially beneficial, collaboration, as you all know, require careful planning and implementation and support. And there is a wonderful part of the Open Door Collective Canoe Guide about how to get started for steps for adult educators and health partners can take to identify and plan appropriate collaborations. So with that, can we have the next slide, Paul? Paul, could go over about possible follow-up actions?
Sure. Thank you, Marcia. Thank you, all the presenters. I know we have a few minutes coming up for questions and answers. We'll put in a little plug here, though. If you're interested in pursuing these documents and even connecting with some of the presenters, visit our Open Door Collective website. You just Google Open Door Collective and you'll find it. There is a set of resources, a resource page that contain links to documents and organizations. And I think you're going to get the same thing through the IHA as well. You might consider joining the ODC's Health and ABE Issues Group. And it's chaired by none other than our own Greg Smith, who's on the one of our presenters today. And we will provide a link at the end of this in the last slide if you want to contact any of us directly. And Julie will talk a bit more about other kinds of ongoing collaboration and communication. But I just wanted to say one other thing here is think about working together between the health field and adult basic education. It's a challenging time. There's a lot of divisions in our society and a lot of stresses we're going through. But as Dr. Martin Luther King said once, we may have all come on different ships, but we're in the same boat now. So with that, thank you all very much. I'll turn it over to Julie.
Hey, thank you guys so much for all of those different angles for this concept of partnering between adult basic education and health agencies. We do have some questions. And I will put the first one, I think it's really for all of you. And I know that you shared some resources with the Open Door Collective on sort of how to get started on these. But Monica asks, she'd like to ask a bit, if you can speak a bit more about creating the collaborations and how, we know they really take a strong catalyst, someone who can reach out and make the personal connection between organizations and sort of be a health literacy champion. And so can you speak a little bit about this role of champion and how to get the health literacy partnerships with adult educators started? And also, along with that, it might help to let each side know how to find the other one, like how does a health place find the adult basic ed programs and vice versa. But really the champions is what Monica wanted to know. I think you guys unmute so you can answer.
Can you hear me?
Yes.
Julie? Yes, I can jump in with this a little bit. I know that, for instance, Wisconsin Health Literacy got started because they had a doctor on their board who became aware of the big disparities among the programs, the adults in the programs that were part of this broader Wisconsin Health Literacy, and really wanted to do something about it. So having sometimes a key figure in your community or on a board of your organization or is a good way to get started. And sometimes, and I would also look at the priorities for foundations. For instance, I know that the Chicago Health Literacy Program was started at the request of a community foundation because they said, we want you to teach health literacy in your adult basic education programs, but you have to do it in partnership with community health centers. So, and if you look at the summer 2019 Journal of Health Literacy and Research, which will be on your resource list. That is all about the partnerships between adult basic education and the health entities, and so that would give you a very good idea about how people got started. How did they get connected? But I think, maybe Paul and Greg, you can talk a little bit more about just how do you find out where the adult basic ed programs are in your community?
Greg, you want to comment on that?
Sure. I mean, there is, I know, at least in the United States, Dollar General Foundation has a national directory that they host that provides, I think it's primarily there to provide referral services to local individuals who may want to, enroll in local adult education programs. But it's also a good resource for finding out what programs are available in your community. And in adult ed, it really, there's no one type of organization that delivers service. It's a mix of, depending on the community, nonprofit, library programs, school district, community or state colleges tend to be the primary providers. So finding one that is there and is interested in this topic and interested in engaging, I think you'll probably be pleasantly surprised that this could be a topic that would be of high interest to a lot of adult ed programs if you reached out to them.
This is Paul. I'll just jump in and say quickly that there's a very good basic question. A quick answer might be for you to contact your state education department or what. It varies from state to state exactly where adult education's home base is, but and some states will be much more organized and more responsive to those kind of questions. But if you had to contact one place, your state education department, you might contact them, and I would assume they have either within the State Department of Education or in another agency like the State Department of Labor. There might be a workforce or adult education unit that could advise you on where you could locate local partners.
Yeah, and just to add a little bit to that.
And then Marsh, just quickly, we do have a couple more, so just to let us get going after this.
Okay. Just to add a little bit more, for instance, in Massachusetts, if you go to the Department of Education, you go to Adult and Community Learning Services, and there you'll find all the programs listed. Now, I'm not sure every state has it, but probably most of the big ones do. So Department of Education, and look for Adult and Community Learning Services.
Mm-hmm. Yeah. Thank you. I would also just say really quickly, once you have your champion, it's also really important to have the program sort of baked into the organizational structure. So if that champion leaves, then the program doesn't fall flat. But we have another question from India, and Kavin Kumar asks if you, Greg, can throw some insights his way about how they can adopt a similar kind of program in India, especially in areas with low resources. Is there anything you can share about that?
Well, I mean, we were really fortunate to have the early support of the Florida Blue Foundation. I know it's, and we are very fortunate that they've really had a long-term commitment. They started with a 3-year grant. My best advice is to try to find a funder that really has, priorities in terms of their mission that is well aligned to this area. And that was the case for the Florida Blue Foundation. They really have a pretty robust philanthropic component to what they do. And they were interested in minority health, public health, and so forth. So this seemed to be a real win-win situation, and we were able to build that relationship over time. Those dollars allow us then to make these grants that in turn allows us to get data. A lot of times if you're providing these kinds of support services in terms of professional development and resources, it's hard to really see the impact. And so this has allowed us to build this program over time because we have some data to support that it's working. I don't know about funders in India, but I'd certainly be happy to talk with you offline if you're interested about some of the mechanics of what we did to kind of build the program over time.
This is Paul. I'll just jump in. I've also worked in international adult education, and I could likewise, as with Greg, refer you to some folks who are doing international adult education and public health related activities if you want to contact me afterward.
Yeah, thank you so much. We we do have we will be able to discuss this on the health literacy discussion list also. So if people have more thoughts or questions or want to share more resources about this, we can talk about that on the health literacy discussion list, which I've just put a link in the chat box to help you find that. You should all be registered for the Health Literacy Solutions Center. If you're in this webinar, you've been registered, and you can find the discussion list on that one. Let's see. We're good on questions. I have a small one if we have time, but I first want to give the presenters a chance to, if there's anything else you want to share that you didn't have time to before. We have a few minutes before we have to close out. Anyone? So I guess one thing I'd like to ask then is that I've heard of I'm trying to figure out, and this is part of finding a champion and how to get your management and maybe funders to sign on to a partnership like this. What are the benefits to the health centers or say a patient education program for this kind of partnership, and what do they get out of it? You had some a bit on your slide earlier, Marcia, but I want to point out and maybe ask you guys to expand on the concept of adult literacy programs being a resource for plain language materials developers to test their materials with adults with low literacy skills. That can be a really good way to make sure that your written materials are easy to understand. Do you guys want to speak at all about that benefit and how partnerships could work there?
This is Paul. I'll jump in very quickly. This is a big topic in New Zealand. Some of you might be aware of this. And in our can-do guide that I mentioned earlier, we have a reference to organization and a whole initiative in New Zealand to do exactly what Julie said, integrating adult education programs with public health initiatives especially around the area of plain language and so forth, and training of healthcare personnel to be more sensitive and aware of these kinds of issues, and how to not just be sensitive, but to be effective in terms of communicating with people that may or may not have, strong literacy or numeracy or English language skills. Canada, I think, has also worked a lot on this, and there are things that have been done in the United States as well. But that's a good question, Julie. That's one area, one of those forms of collaboration that we didn't mention, but it's on our list.
Yeah, this is Marcia. Can you hear me?
Yes.
Yes, okay. Yeah, I was going to say, when I was working with research with a student health team at Operation Bootstrap in Lynn, Massachusetts, that's one of the things that we did for the community health center and also the local hospitals, was to review the materials that they were developing and suggest where vocabulary maybe be too hard, where the background knowledge that they're assuming isn't there. And I remember one learner said to me, you can talk about mammograms till the cows come home, but because the concepts of prevention and early detection are not something that were in people's minds because they are never talked about in the healthcare systems they come from, it's just going to go over people's head. They won't be be able to absorb because they have no framework for it. So I think, having learners review materials that you're developing, especially when you're trying to communicate with limited literacy audiences or different cultures, is a wonderful way to partner with the program. It's very specific and very fruitful, and students are really good at giving good feedback.
Thank you. Hang on, I think we have another question. Is there do you have a way to standardize to qualify requirements for literacy in international health literacy? This is from Sam. I wonder if maybe you could clarify that. Or if we could unmute, Mario, can we unmute his mic? Or yeah, or if not, we can, Sam, we will get in touch with you directly and make sure that we can understand your question. And then we will, if other people have questions, we will answer them on the health literacy discussion list. Oh, wait, are you there?
I'm unmuted. Can you hear me?
Yes.
Okay, so here's my question. You know that when you talk about health literacy in this country, in the United States, you say, okay, maybe up to 7th grade, you know, middle school or elementary school, you know, that's the thumb rule probably that I've been hearing. How would you standardize that against international requirements? That is the question.
That's a very complicated question.
Yes,
It's so contextualized, you know, and using grade level equivalencies has been rejected in our field for 25 years. We're talking about very functional kinds of language and literacy, and it depends on what the requirements of that literacy task are. I mean, you know, if we're training people to become, you know, at a very complicated level, then the standard is higher. If there's some very basic information and literacy tasks, you know, the standard will be lower. It depends on the individuals and the need and so forth. And I'm not dismissing what you're saying. It's a legitimate question, but it's not something that's really easy to answer.
Yeah, and I would encourage you, yeah, it is a complicated question. Things are so different in so different countries. There's an International Health Literacy Association, ILA, it's I-HLA. If you can connect with them, Sam, and others who are interested in sort of global health literacy issues, they have some great webinars and some great resources. I'll put their information in the chat.
Are they in the United States, or they are somewhere in Geneva or somewhere else?
They filed in Geneva, but they have sections from all over. You know, that there are people who represent different areas of the globe. So they're not really stationed in one country or not another, but they have leadership in US, Europe and Africa and Asia. So so I would encourage you to get in touch with them. Yeah, I think it's just isla.org. I'll put this in. So thank you, everyone. I know we have to get going now, but like I said, we can start a thread on the discussion list and keep talking about this. This is a really important and useful topic for us all in health literacy to be aware of, and it's another fantastic and relevant field for us to connect with. So just quickly, I think yeah, I just have one more thing I put in the chat to access the conference website. I hope we'll see you all at more sessions during the conference, and I just want to thank Janet and Paul and Greg and Marcia so much for this session, and I hope it leads to more partnerships, and I hope that people will use the discussion list and the Solution Center to help find partners and advice for these partnerships. So thank you, everyone.
Okay.
Thanks.